Hey everyone, good morning. Hopefully, everything looks good. So, we're going to be talking about anxiety today. I decided to take a step back from some of the more complex topics we've been talking about. And here instead, we're just going to go through anxiety in terms of basic mechanisms of action, types of anxiety, how to treat anxiety, and how anxiety is relevant to the psychology of awakening. And for those who are here, feel free to ask any questions. This is all for you. Feel free to ask anything, whether it relates to anxiety or psychology in general. All right, so let me go ahead and put that prompt in and then we'll get started. Okay. It seems like I scare off people when I tell them to ask questions, so we'll just we'll just leave it as is for a comment this time and see what happens. Okay, so starting off with anxiety here. Anxiety is a complex cluster of biologically, psychologically, and socially based mechanisms. We all know what anxiety is. Perhaps the easiest way to describe it is a combination of fear and worry. These are the two things that we see more than anything else when we're clustering anxiety disorders within the DSM-5, the manual that we use for mental health disorders, and when we look at anxiety in general. When we talk about fear and worry, we'll go through some biological mechanisms. But as we talk about these things, I want to help you understand things not only from a biological perspective, but also from a psychological one. We're going to see mechanisms of action that have both a biological basis and a psychological basis. For those of you who have seen my other live stream about the 55,000 studies that were parsed through and looked through for core psychological mechanisms or processes of change, this is what I'm getting at. We can look at both biological mechanisms and psychological mechanisms in a non reductive fashion, meaning that we can get unique information from either side. So let's start off with talking about what exactly anxiety is. Anxiety is very common and for most people is not a pathological experience or emotion. Anxiety has very useful characteristics and is often more helpful than not in terms of navigating situations and engaging in goal directed behavior. If you ever go to a therapist and you ask them about anxiety, more often than not, they're going to bring up the therapeutic bear, saber-toothed tiger, whatever predator you can think of, and they will talk about how anxiety is something that is helpful in those types of situations, right? Dealing with uncertainty, dealing with threats. If a giant tiger or bear jumps into your room right now, you're going to have a huge wave of anxiety, and that anxiety is going to either make you fight, run, or freeze in place in order to deal with this threat. So, whatever it is that comes up, anxiety is helpful in that sense because it helps us problem solve certain situations. In this way, anxiety is adaptive, it is helpful. Anxiety can allow us to encode information more effectively, so long as the anxiety is not too severe. When I say encode information, this relates to things like imagine for yourself that you're studying for a test or you're preparing for some kind of presentation. You might have surges or waves of anxiety as you prepare, and this is totally normal. We can see that with low levels of anxiety. I think that's the Yerkes-Dodson curve. Perhaps it's been updated since because that's kind of old in terms of literature. When you look at anxiety, you kind of have a bell curve, right? Just to show my hand here, it's going to go up and then it's going to go back down. So as we go up in terms of anxiety, the ability to encode and formulate memories and problem solve things, it actually goes up to a certain extent. Now, it's stressful and it's difficult, not necessarily a positive experience, but it does help you to a certain degree. After a certain point, however, anxiety can become more disruptive. If we have severe anxiety, overwhelming anxiety, then we start to see a decline in terms of how effectively we can use our own psychological functions, our ability to think clearly, our ability to problem solve. These things start to go downhill when anxiety gets too severe. And this is often what we see for anxiety disorders as well. Whenever we get to my cat's in the background, apologies for that. When we see anxiety disorders, we see that the level of fear and worry that is experienced, it gets to a point where it's clinically significant in terms of distress. When you get to clinically significant distress, that's when you start to see problems in terms of day-to-day life, your ability to get things done, social, occupational, all those different domains that you see within the DSM. Once you get to that point and that anxiety has persisted for a while, this is often where people start to consider treatment. Perhaps they've tried things themselves, they've tried over the counters, they don't really know what to do at this point. They feel like anxiety is running their life, and then they come for treatment, whether it's through medication, therapy, or a combination of both. So that's a basic overview for anxiety there. In terms of biological mechanisms, very, very basic level here. I don't want to get into a neurobiology lecture, but when we talk about fear and worry, we're looking at two key structures of the brain. In terms of fear, we are primarily looking at the amygdala. Amygdala is Greek for almond, and it's a little almond-shaped structure, just like it sounds, right in front of your hippocampus. And there's two C-shaped structures here that go through to the front of the temporal lobes. Those are both the amygdala. Now, the amygdala, again, it's primarily involved with fear, but you tend to see the amygdala activated for aggression responses as well. Fear and aggression are kind of like two sides of the same coin. And you can probably think of personal examples or examples from other people where this is the case. Things that are, or beings that are within a state of fear are also perhaps within a state of aggression. They tend to switch back and forth there. It certainly can be the case and often is. Now, in terms of worry, things get a little bit more complicated. We have a primary loop we call the CSTC loop, cortico-striato-thalamo-cortical loop. I'm not going to go in depth on that. It's a lot of jargon. Just know it's a lot of different brain structures that are wired in a certain way such that as we engage in worry loops, this neurobiological domain becomes more active. When it becomes more active, we have a target for treatment, right? You can use medications to not attack, but change certain parts of the brain in terms of functioning. So when we talk about fear and worry, and both of those for anxiety, we can address those with medications. However, do we always need to use medications for anxiety? Probably not, right? When we look at treatment guidelines, we see a mixture of therapy and medication in most cases. Now, therapy, in my opinion, is often the place you want to go to first. Therapy is going to be most helpful for most people. There are some select cases where medication can be helpful. We'll come to that in a little bit. So, in terms of biological mechanisms, just know there are some biological correlates that very closely align to types of anxiety that you experience, especially in terms of fear and worry. Now, when we talk about psychological mechanisms that are at play, there are many, many different factors involved. Anxiety disorders are one of the most common, along with depressive disorders, in terms of prevalence rates. I haven't checked the most recent statistics, but I believe it's something like 20% of the population at any given year is going to develop some type of anxiety disorder. That is substantial, right? We're talking 1 in 5 people with some sort of anxiety disorder or dysfunction. And if you want to tack that on to biological mechanisms, psychological mechanisms, or social mechanisms, you're probably right. in terms of all three. But regardless of what the cause is, 20% is a substantial number. We certainly are in need for treatment and methods to manage such an emotion. For those who have experienced anxiety disorders or overwhelming anxiety, which is probably everyone at some given point in time, it is pretty detrimental. It's very difficult to deal with crushing levels of anxiety, feelings of impending doom, like things are going to end. And it gets even worse when you buy into that anxiety. It creates this loop. We talked about worry. When you start to buy into that worry, you are reinforcing these worry behaviors and thought processes. And when you do that, things get worse and worse. And soon enough, you're developing an anxiety disorder. We see a similar pattern with depressive disorders as well, right? Lewinson's model in terms of avoidance and worsening depression. Similar patterns there. Anxiety and depression, it's debatable in terms of how different these two are, right? They're so comorbid that differentiating them is actually quite difficult in a lot of cases. But, anyways, in terms of anxiety, the psychological mechanisms at play, there's quite a few of them. And let me see if I can share my screen here. I'll pull this back up. If not, I'll just read it off to you. Yeah, I'll just pull it up on the side here and read them off. We don't need to keep going back and forth in terms of windows here. So when we looked at those mediational findings, and mediational means what core psychological mechanism explained the development of an anxiety disorder or this type of mental health disorder, we can see that psychological flexibility plays a pretty big role. We'll talk about that in just a little bit here. Mindfulness was involved. And then number three was negative, unrealistic, or dysfunctional thought processes. And emotion regulation is lower, but again, there's multiple reasons why these core psychological mechanisms are laid out the way they are in that study. In terms of what I want to get across for core psychological mechanisms of action, I want to lay this out as a conceptualization model. Okay, we're going to look at behavioral factors, cognitive factors, physiological factors, affective or mood factors, and then dimensions of yourself, and then sociocultural factors, right? If we were going through therapy or something, we would want to do a very close analysis of all of those different domains. Now, I'm not going to bother with that. I'm just going to focus on a key few areas, and then we're going to go into different strategies that can actually help with anxiety. And as we will see, how you want to manage your anxiety is perhaps going to be the most important thing in terms of a type of treatment or recommendation that you would want to get. Because of the changes there's going to be different layers and different levels of involvement in what you may or may not want to do. We'll come back to that as well in just a little bit here. So the next thing I want to get to is your anxiety truly a problem? We want to think about this very carefully. Obviously, people experience anxiety, and because it's such a negative experience and because it's so difficult to sit there and deal with fear and worry, they often want a quick way out of this anxiety. They might immediately turn to medicine. They might immediately turn to over the counters or someone else to solve their problems. But more often than not, what we find with anxiety disorders is that your ability to deal with anxiety, just being able to believe and actually prove that you can manage your own anxiety, this is perhaps one of the most important things for dealing with anxiety disorders. Oftentimes, we see that with fear and worry, people lose this sense of control. They feel that they can't control what is going on. We might think of this conceptually in a number of different ways. If we want to use the psychological flexibility example, these are characteristics of an inflexible mind, someone who is very fused to their thought processes, for example. They're immediately going to buy into fear and worry. And then when they become fearful or worryful, they are just going to buy it at face value. Well, I guess I'm an anxious person and I'm just going to be anxious all the time and I'll never get things right. Things are always going to go wrong. I just made one small error at work and now I got disciplined once for it and the whole world is over. Those are signs of someone who's psychologically inflexible because they can't separate from these mechanisms that lead to fear and worry, and more importantly, to the adherence to fear and worry. If we want to look at it from the perspective of emotion regulation, we can also simply say that such people cannot regulate their emotions sufficiently. If you could regulate your emotions to a good manner, the fear and worry, you might experience them, but they wouldn't become so overwhelming that you lose control. Similarly, if we want to look at things from more of a cognitive behavioral perspective, we could talk about the thoughts, the behaviors, and the things I just mentioned are within cognitive behavioral sciences, but I'm getting more at transdiagnostic approaches. And what transdiagnostic means here is that it works across disorders, right? You don't just see pure anxiety in most cases. In most cases, you see anxiety is intermixed with other types of disorders because those other types of disorders often involve fear, worry, and a lack of control. So, if we're looking at PTSD, for example, post traumatic stress disorder, you see that anxiety and depressive symptoms are hallmark core criteria. Or in ADHD, for example, anxiety disorders are highly comorbid. Or if you're looking at substance use disorders, high levels of anxiety as well. Those all come into play together. So, in terms of core mechanisms for anxiety that becomes dysfunctional, and whether your anxiety is truly a problem, we want to do an assessment there. How bad is the anxiety and how long has it been bad? We want to do a if I was going to see someone for therapy, I would want to go very far in depth in terms of a timeline, right? What was the onset of the anxiety? When did it start? How often does this anxiety come up? How intense is this anxiety? How long does the anxiety last? We need to know these kinds of characteristics, and we also need to know why the anxiety is occurring. If we don't know these things, it's kind of like, I'm not a cardiologist or anything, but it's kind of like somebody coming in for, as I would imagine, high blood pressure, and then somebody just immediately jumps and says they need open heart surgery or something. Not the case, right? We need to do a workup and figure out what exactly is going on. There's many different variables at play that control blood pressure. In the same way, there are many different variables at play that control anxiety. We need to root things down to core mechanisms, biologically and psychologically, to see where we need to intervene or structure treatment approaches. So that's what we call oftentimes a functional analysis in psychology. Once we get to the root causes of where your anxiety has come from, and we can see that anxiety arises, for example, maybe somebody had a bad day at work, they went to a grocery store, they had a panic attack in the grocery store because they were fearful and worryful, and now they're just so fearful of going to a grocery store that they haven't been in 6 months, and it's just debilitating because they don't even buy groceries, they're losing weight, they're getting depressed. This is where we start to do more of that functional analysis, right? What happened at work? What was the cause? What was the chain? What led to the anxiety and the panic attack? The more you can structure and understand about your anxiety, the more opportunity you have to make a change in terms of how you identify with this anxiety. This is such an important treatment area for dealing with your anxiety that without this, it is often impossible to treat anxiety disorders in a therapeutic setting. Just being able to structure things, that alone helps so many people with anxiety. When people have anxiety disorders, like generalized anxiety disorder, this is a type where you just worry about anything and everything, and it just spirals into potential panic attacks at times. It's such a debilitating disorder. But almost always, especially my own experience working with patients, they don't feel a sense of control. Whatever thoughts, whatever fears, whatever worries come up, they identify with it so readily that they lose themselves within these anxious thoughts. And once those anxious thoughts come up and they get stuck there, then they just spiral downwards, and they spiral oftentimes into problematic ways of dealing with anxiety. Because no matter what you do, you are going to engage in some type of behavior to deal with anxiety. Oftentimes, the mechanism people turn to is avoidance. Avoidance is very, very problematic because it works. I know that sounds really strange, but avoidance does work in the short term. It does not work in the long term, not at all, right? If you are feeling really anxious, let's say that saber-toothed tiger or bear or whatever it is comes into the room and you run away, in that sense, yes, you have fixed the problem, because what was making you anxious was that animal, that predator, that threat, that uncertainty, and you got away from it. You have solved the problem there. You don't feel anxious anymore once that threat is over. However, when you are dealing with your own mind, you can't escape like that, right? You can try all you want, but you are going to be stuck with your own mind because that is all you have. It's almost like a cruel joke in some ways, right? Whatever thoughts you have, it's like tenants inside of an apartment that is your body. Once you have those tenants and they're annoying neighbors, the more you tell them to stop, then you're kind of reinforcing problematic behaviors there. Now, what you're supposed to do is you're supposed to go and have a heart to heart, deal with the root cause, get to the issue at hand, and then deal with it that way. But doing that is often so difficult because initial distress is what you have to tolerate to make change with psychological functioning. Avoidance, hey, you get out of the situation, you feel good in that moment. I can't tell you how many substance use disorder people I've dealt with who tell me, hey, if I just drink my alcohol, I can get away from my anxiety and I feel good in that moment. I'll drink to the point of blacking out. I'm good for that night. The next day, yeah, I feel like crap. Everything sucks, but I already feel like crap anyway, so I might as well do it, get away for a few hours, and then come back. But what they don't realize is that they are reinforcing this anxiety, right? The very act of avoiding anxiety is a way to deal with anxiety. And when you realize this connection, you see that avoidance worsens anxiety because they are causally linked. So, what we would do in therapy is we would break this, right? It's almost counterintuitive. You're feeling anxious, you're having thoughts about anxiety, and this fear and worry is overwhelming you. What should we do in that situation? We should figure out what it is that is causing you to be fearful and worryful, right? It's almost like a mental or psychological, using that same example, a mental or psychological predator is there. We need to figure out what it is. What is it that you're trying to run away from? If you're trying to run away from some prior experience, right? Let's say you had somebody. I can talk about a patient I saw actually. She's a very memorable patient because of how much she was suffering, and it was such a privilege to help her out. She was having such difficult experiences because of the degree of trauma that she had been through earlier in life from childhood abuse, that it was unbearable for her to sit there in thought, even for 10 to 20 seconds, right? Even just sitting in thought for 10 to 20 seconds was unavoidable. She was a really smart person. And what she would do was she would keep herself super, super busy in life so that she never had to deal with her own thoughts. I can think of many other people who engage in this similar approach. In terms of psychological mechanism, we're talking about avoidance, right? Staying busy to not deal with mental distress is a form of avoidance, and you are doing everything but dealing with that core problem. The core problem for her was that this difficult experience occurred and she never dealt with it. And because she never dealt with it, this problem became worse and worse because she tried to run away from what happened. So what we ended up doing was to deal with this anxiety, and this was anxiety in the form of a post-traumatic stress disorder for her because what she went through was so severe. What we ended up doing was we just started with training her ability to sit with her emotions. As crazy as it sounded, that took a long time. Just sitting and being able to reflect on your own thoughts for 15 to 20 seconds a day, That was so overwhelming for her. It took almost a month to get that in. And then once we got to that point, she started to see that, hey, I do have this capability. I can sit with my thoughts. I don't have to be controlled by my anxiety or worry. If anything, it's the other way around. My anxiety and worry does what I train it to do. And this is actually the case not only when you look at literature, but also when you look at your own personal experiences and when you work with patients or clients. The way that your anxiety manifests is a reflection, excuse me, the way that your anxiety manifests is a reflection of how you have identified with your anxiety and the causes of your anxiety in the past. So, if your anxiety is so overwhelming that you can't deal with it, we need to look back and see how things got to this point because there is some sort of cause that led to this. Now, getting back to what I was saying a little bit earlier about treatment options, the things I've been saying for the last few minutes, these have been psychologically based. This isn't always the case for everybody. In some cases, we need to look at biological mechanisms of action, right? When we look at the 5-factor model for personality as an example, this is, I don't need to get into the jargon here, but it's a set of personality traits that are rooted in biological mechanisms, okay? So, personality, how we think, how we identify with our environment and ourself, those can be traced back to biological origins for a good proportion of the traits that we can identify as personality. Now, in terms of that personality, those personality structures, trait neuroticism is one of the key constructs. And trait neuroticism, an easy way to think about this, it's kind of like your ability to deal with distress, right? It's the likelihood that you are going to develop a serious psychological problem when something stressful or difficult happens to you. When we're looking at, and I'm going back to military experience here, but when we're looking at Navy SEALs, airborne rangers, special ops people, we're seeing people who are very, very low in trait neuroticism, right? We can deploy these people to the middle of a battlefield where death is imminent and likely, and they're cool. They are so used to it, they can deal with those situations. On the other hand, we have people who are very high in trait neuroticism. If you put them through any type of experience, and we know that the number of stressful experiences you go through correlates to your likelihood of developing a psychological disorder or anxiety disorder. If we put those people in a stressful situation like a war zone, for example, they're probably going to develop a post-traumatic stress disorder, right? And these are people that in the military, again, as an example, we send somebody out for deployment and they're really high in trait neuroticism and something difficult happens. Let's say they're in the medical corps and they have to transport dead bodies to send them back home and they develop a post-traumatic stress disorder. Well, we can try treatment, but after a certain point, the military is going to say, okay, this person is not suited for duty. Let's get them out of here. Right. So we're looking at different personality constructs there. And in this same way, when we look at anxiety disorders, we're going to see that the degree of anxiety that we experience, there are biological roots involved. And that was just a long aside to explain that in some cases, yeah, medication is going to be very helpful. Now, again, oftentimes I would not recommend medication. Oftentimes we need to do that functional analysis. We need to get to the root causes. What led to the anxiety? What was the event? How do we deal with it? How do we manage coping mechanisms? How do we get core psychological processes of change? Let's do this together in therapy and figure it out. That's a great way to deal with it. But in some cases, anxiety is so overwhelming. I've seen people before for forensics evaluations where their anxiety is so bad, they haven't left the house in 3 years. Like literally not a single time. They haven't stepped their foot outside of the house in 3 years because they are so worried that something bad is going to happen. You ask them what's going to happen if you even step a foot outside. Well, a car might come and hit me. My dog might run outside. I might catch a disease. Something's going to happen. And most people would probably say those things as a joke, but when you hear these people and you see how they're living their life, it's not a joke for them. It's dead serious. And you have to take it that way because the way that they experience and perceive their reality, it's a function of their own psychological functions, right? And anxiety that's overwhelming, you're going to see people who constantly have fear and worry. And when it's that detrimental, we really need to do something. If you're so anxious that you can't even make it to a therapy appointment, you can't even go to an online therapy appointment because of how worried you are that the therapist is going to judge you or something's going to go wrong, that's when you might want to consider something like medication. There are biological bases for anxiety. An easy way to look at this is to look at your own family history. Do you come from a family where your parents were highly anxious people, your siblings, your cousins, biologically related, even non biologically related people can have an impact as well. So we can look at genetics, we can look at heritability, family history. That can help us differentiate what type of anxiety we're dealing with as well. Oftentimes, for myself, I will see that people who have high levels of biologically based anxiety, more so than psychologically based, they will often tell me things like, my life is fine. Everything's good. I'm married. I've got 2 kids. I've got a great paying job, a house, everything you could ask for, I have. But for whatever reason, I still have this overwhelming anxiety. Those people who describe things in that way, when we can't find a singular cause or a singular chain of events that has progressed and led up to an anxiety disorder, those are the ones where I'm considering a little bit more in terms of medication referral or getting them biologically or physically medically evaluated. So the point I'm making here is that just because you have anxiety does not mean it is automatically psychologically or biologically based. We need to do a very careful and thorough evaluation to see what type of anxiety you have. It may even be the case that you have both types of anxiety. In that case, medication and therapy, or one or the other, could work, but you should find a good professional who can help you out with that. Now, in terms of treatment options, so I've already talked about medicine here, and I've talked a little bit about therapy. And to be totally fair, there's many different types of therapies, and I have my own preferred ones. Anxiety disorders are common enough and studied enough across therapies that there are many disciplines that can work. If you want my opinion, all of the therapies that are good and are going to have an effect, they will boil down to core psychological mechanisms of change. Process-based therapy is a type of therapy that pulls core psychological mechanisms of change and then applies it to an individual instead of looking at people as a group, which I think is great because when you study people enough and you study behavior enough, you see that people are so unique that you can't just cluster them into groups. To me, if I'm your therapist and you're working with me, you're not just a person with generalized anxiety disorder. You are an individual who has all these different traits, characteristics, psychological functions, biological functions, sociocultural upbringing. We're going to look at every single part of your being and see where this anxiety comes from. Because when you just say generalized anxiety disorder, you're looking at diagnostic criteria, right? Anybody with half a brain can check a box, check 5 out of 9 boxes or whatever it is, and say that you have a disorder. But how do we actually get to the root causes and deal with those root causes? That's where the skill and the practice comes into play. All right, so let's keep going here. I don't see any questions, but if there are any, I'm happy to answer them. So in terms of the core basic chain that we want to get into for dealing with anxiety, let's say we're focusing more on psychologically based anxiety, even if it's biologically based, these steps will still be helpful for you. Okay, so we want to look at the problems, the diagnoses, the causes, the hypotheses, and the treatment planning. We want to look at all those factors together. If you're somebody who's dealing with anxiety on your own, you really need to, and you're not willing to work with anyone, I certainly would encourage you to work with someone, especially someone like a good therapist, because they can give you that objective stance that's outside of yourself. But let's say you're sticking to yourself and you want to manage it on your own. I would encourage you to look for those root causes that have led up to this anxiety. Can you find a timeline? Can you find a pattern that has led to worsening anxiety? That alone is therapeutic. Don't underestimate the importance of just being able to sit and look within your own psychological functions. People are often immediately turning to therapeutic approaches. Oh, I need to get into mindfulness breathing. I need to get into meditation practices. I need to go and, do a whole course of dialectical behavior therapy. Not necessarily the case, right? Again, one of the most important things is being able to actually believe and prove to yourself that you can do something about your anxiety. You wouldn't get to the point of a severe anxiety disorder unless you lost that belief and that capability that you can do something about your anxiety. Because if you truly believed you could do something about your anxiety, you would, right? You would. And eventually you would find something that works for yourself. Now, if you get into something that's problematic, like turning to alcohol, avoidance, drugs, substances, that's a different story. But this belief that you can do something long term and actually treat your anxiety, that is very therapeutic in and of itself. Okay. So, in terms of approaches that I want to discuss, I want to give a few like very, very specific, useful tools that can be helpful for people. Because oftentimes, when you look up videos on how to deal with anxiety, and I've kind of done the same thing here for the last last 36 minutes, I'll try to do better here. You see people talk about anxiety, right? Here's how you treat it. Here's how you do this. Here's how you do that. But then you'll see in the comments, how do I actually do this? Okay, so that's what we're going to try to focus on for this second half. This is the hard part. All right. It's very hard to explain and understand mental symptoms. I'll give you one of the core things that I'm going to teach you to do here. And this is easier said than done, but it is a way that works. It's reliable. I know it works. I've done it for myself, I've done it for other people, and they've told me it works. Okay. So, this approach that works is learning to multiple different approaches here. This is just the first one I'm going to go over. And this one's the most relevant for the psychology of awakening because this is the key mechanism that you practice for other things as well. The core skill here is learning to be still to your mental experiences. If we're talking about well, actually, let me not do that. I'm just going to give you the skill here and then we'll talk about it afterwards. Learning to be still to your own mental experiences, learning to be still to your fear and your worry. Okay. So, how would you actually practice this? Just like the patient I had before, how long can you sit and deal with your anxiety when it comes up? For someone with an anxiety disorder, they're going to sit and they're going to feel fear and worry about their experience. I don't want you to turn to a distraction technique. I don't want you to try some crazy breathing technique. I don't want you to do anything. Just sit there and watch your anxiety. Just watch it. It's all I want you to do. Just watch it. See what it's doing, see what's going on. You're not trying to intervene with the anxiety. You're not trying to push it away. You're not trying to fully absorb yourself in it. You're just watching your anxiety. And what happens over time when you do this? So, for example, let's say right now I'm sitting here with my anxiety. I'm going to give you a direct practice here for just a few seconds, just to show you what it looks like. Let's say I'm sitting here, I'm fully anxious. I'm wondering if people are going to ask me hard questions. I'm feeling fearful about all those things. Well, if I was going to put this practice into play for myself, I would just sit here for a second, right? You can do this close eyed, you can be open eyed, it doesn't matter. Just try sitting there for 30 seconds, for a minute, and see what happens to your anxiety. I'm not going to sit here still for a minute. I think you could practice that on your own. But the takeaway I want you to get is that when you actually do this, and I hope you do if you are struggling with anxiety, by the way, because this is very helpful. When you sit there, even for just a minute, and you watch your anxiety, there's a degree of separation that you start to build, right? Because the very act of watching your anxiety, just listen to what the words are here. You're watching your anxiety. For most people who have anxiety disorders, they are being their anxiety, right? They don't tell you I'm feeling anxious. They tell you I am anxious. I am an anxious person. There's such a separation there. It's so important. When we talk about the psychology of awakening, this is one of the biggest roots that we need to remove to realize the ways to end psychological suffering. We need to realize that all of our mental experiences, everything that goes to that conventional reality I've talked about, or reality as it has been made by your psychological functions, all of those things have a nature of arising and falling. They come and then they go. Your anxiety is the exact same way. If you watch your anxiety for long enough, it will start to dissipate. Attention is the fuel for that anxiety. If you see that and you truly understand it, and your attention now switches to watching your anxiety as opposed to being anxiety, your anxiety is just like a match. Okay, so the match is lit, it's burning, it's hot. If you just sit there and you just watch it very slowly, right, the wood is going to start to burn, but eventually the fuel runs out for that anxiety. And when that fuel runs out, if you haven't freaked out and dropped the match onto a piece of paper and worsened it, now the house is burning down. If you just watch it and you just let the match go out by itself, all that's left is a husk of ashes, right? Burnt wood. It's the same way with your anxiety. If you can sit there and watch it, just like a tantruming kid, right? Little 2-year-old at the grocery store being a brat, you know how they put the candy just low enough to where the little 2-year-olds can grab it. I think that's on purpose, by the way. That kid is going to tantrum, right? Give me the candy. Give me the candy. They're going to like pull and they're going to shake the shopping cart and they're going to scream and do all this stuff. What happens if you just sit there and watch, assuming you can even do that in the first place? Kid's going to give up after a while, right? Unless you've got a real brat, they're going to give up after a few minutes. It's the same way, right? Attention is the fuel. Behavioral reinforcement comes from attention for the most part, especially in this case with anxiety disorders. Okay. So when you realize this and you pull the fuel away from the anxiety and you just watch, it's going to be very difficult at first, by the way. Why? Because anxiety and your mental processes, they're just like little kids tantruming. When you pull the attention away and you start to watch, anxiety is going to spike. This is where people get stuck. As soon as the anxiety spikes, they freak out and then they go back to doing what they were doing. It's like, oh, this is too difficult. This made anxiety worse. I should not do this. But that's exactly why you should do it, right? Because you've induced a change in yourself. And that's awesome. If you recognize a change in yourself and you are able to adhere to that change, you are causing a change, right? By definition. And see where that goes, right? What's the worst thing that's going to happen, right? You already have an anxiety disorder. You're already struggling with anxiety. Let's try something different and see what happens. And I can tell you, obviously, I'm not trying to throw you off the deep end here, but I can tell you this is something that helps over time. You build this ability and this faith and belief and understanding in yourself that you can watch your anxiety and you don't get stuck in it. So try doing that for just 30 seconds, just for a minute, see what happens. I'm seeing a comment here. Yeah, absolutely. Absolutely. Awakening and psychological treatment, I see those things as, yeah, I'm totally with you on that. They go hand in hand. I think Buddhism is a great example here. There's a lot of different suttas or different what's a good way to put this into words? Different specific teachings where they talk about removing the roots for psychological suffering. And it's transdiagnostic in that sense, right? We can talk about it in modern terms, anxiety disorders, depressive disorders. But really what we're doing is we are looking at the causes for psychological suffering. This first example I give, it relates to attention, right? We're looking at those causes and then we're taking those causes away. I didn't really get into this for this discussion because this could be a few hours in and of itself, but language is another big one, right? Relational frame theory, psychological flexibility, acceptance and commitment therapy, process-based therapy, transdiagnostic cognitive behavioral therapy. These are all pulling very significantly from language. When I say language, I'm talking about your thoughts, your feelings, all of those different things. When we root it down to relational frame theory, we have very clear core mechanisms of action. And one of those core mechanisms is something we call fusion. To what extent do you buy into those anxious thoughts? When you buy into your anxious thoughts, that's where the attention comes in, right? That's where you start to believe things at face value. That's when you lose focus of the present moment. That's when you get stuck there. And for those, and perhaps this is the case for you as well, I truly hope it is, but it's such a peaceful place when you can remove those root causes and just sit there and abide peacefully within your own being. The analysis is simple, right? I think the default mode network summarizes this pretty well. Default mode network is a set of brain regions that very, very well studied at this point relates to your sense of individual self, your language functions, rumination, thoughts, fears, worries. And when you engage in these meditative practices, you learn to watch your experiences as opposed to being them. Not only does this default mode network activity decrease, but other brain networks increase in activity as well. And these brain networks are much stronger in terms of how attention is applied outside of the individual thought process. And this is wonderful because when you do this, you find that you become mindful. I've made a brief video on mindfulness. I might go into it a lot more depending on what my viewers want. But in my experience and my understanding of the literature, and this will come out in the book I've written later on as well, mindfulness is more so a reflection of properly trained attention as opposed to being a practice in and of itself. I hope that makes sense, right? For someone who has properly trained their mind, they will naturally be mindful without directly training mindfulness. And this is a great thing in terms of dealing with anxiety because someone who's mindful, they see their thoughts rise up within who they are as opposed to being that thought itself, right? If I'm sitting here and I'm thinking about something, I notice that the thought rises up within me. It's not that I'm the thought in that given moment. It's a thought. It just comes and it just goes. Whenever you recognize this and you don't buy into the thought, there's a very big difference between having a thought, buying into a thought, and adhering to a thought, right? You can let go of a thought. I forget the exact number. I'm trying to think from literature here, but it's got to be in the tens of thousands at least. We have tens of thousands of thoughts that we don't even give a second glimpse to, right? Why is it that some specific thought relating to anxiety, why is it that that's what we adhere to the most, right? And the reason why is because they have a negative value. You see this often in social media and the business of psychology. People are very attuned to negative experiences because when you think back to survivability, again, if we use the same example from before, talking about like predators, a giant bear comes in the room, you feel anxious about that, they help us survive, right? Yeah, that's great. That is really, really good. ADHD, I'll perhaps make a video on that as well. Um, Kind of a superpower of attention in certain ways if you know how to cultivate that. I totally agree there. Can be very difficult as well. So yeah, ADHD, anxiety, again, these disorders tend to be comorbid, especially if you don't have that feeling of control or understanding. When you put that structure into how you realize things and understand things, that can help you across disorders as well. I can't tell you for how many patients just sitting down, even for 2 sessions or 1 session in some cases, just sitting down and giving them the floor to talk and to think about what it is that's going on. Because usually, like if you have an anxiety disorder, think about how much of your mental real estate is taken up. And by real estate, I'm talking about your thoughts, your feelings, your emotions. If you're not sitting there with a clear mind and you're lost in thought, that's what's going on, right? And ADHD, for example, as well, but it's true for other disorders also. Your real estate, what you're doing, kind of like when you're idling, so to speak. If you're constantly going from thought to thought, that's an example. If you're constantly stuck in anxious thoughts, that's another example. For many people I see, I don't want to say all of them, but it's a pretty high percentage. They struggle the most with their anxiety when they are trying to sleep. And the reason why is because they're not distracted anymore, right? The moment they try to clear out their mind, something has to jump in there, right? This is when the anxious thoughts jump in because they've been avoiding for so long, being distracted, doing things in life, day to day activities, working a job. The moment they sit down, their anxiety is flooding in, right? All these thoughts and things come up. And the twisted part here is that your anxiety is actually trying to help you in a certain way. I know it doesn't feel like that. It feels very painful and difficult. But remember that our mind is heavily biased towards problem solving. These anxious thoughts, they're coming up in certain ways because they're trying to help you problem solve something. Now, again, we can go back to the biological argument. Yes, in certain cases, anxiety can be dysfunctional, is based on neuropsychological or biological substrates. But for the vast majority of people, this is not the case. A trauma disorder, for example, if you have PTSD, why are these recurrent thoughts, images, nightmares, flashbacks, why are these coming up over and over and over again? Right? What's the utility and value in this? Is your body just trying to torture you? Is your mind just trying to put you through it? That's how people feel. But once you do a deeper analysis, it's often not the case. Your mind is trying to help you manage or deal with something that has happened to you, right? So if we're talking about if we're talking about PTSD, for example, your mind is trying to work through what it is that has happened. There's a different therapy. It's called image rehearsal therapy. I won't go into it too much here since we only have a few minutes and we're focusing on anxiety disorders here. But essentially, what you do is that you deal with the nightmares that people experience, and they will come in, tell you about their nightmares. And I suppose this is also very relevant for anxiety because people with severe anxiety disorders, they do also have nightmares, and those nightmares can theme around repetitive things, especially as related to specific life experiences. So, whenever this happens, we can change the way a dream or an event is interpreted. This is another technique that we can use that's really helpful. Just because you have an anxious thought, even there, my wording's loaded, right? Just because you have a thought that you associate with anxiety, that doesn't mean that's what that thought inherently means. I can give you a good example from someone else I've seen in therapy long ago. This was someone who he had an eating disorder and he was trying to work with it. And he came to me one day and we have a screener for depressive symptoms. One of the questions at the bottom is about suicidal thoughts. And as we were going through therapy, all of a sudden he started to tick up on suicidal thoughts. And I was just going, whoa, what's going on here? Let's talk about this. And as we went through together, we found out that as he was cutting calories in his diet and trying to manage his weight, the response his body was giving, the negative parts of having to withhold calories, for any of you who have done that before, it's quite difficult at first, especially if you've been eating junk food or unhealthy foods. Your body really tantrums hard. He was experiencing suicidal thoughts, and these were coming up as a way of his body telling him, oh, sorry, my cat's tantruming down here too. I'll be with you in a second, okay? So, what was going on was he was having suicidal thoughts because he was having these negative experiences, right? Losing weight, feeling the distress of that. And then once we worked through that and we realized that these thoughts actually dissipated, it's just fascinating how this works. Once he realized the cause of those thoughts, and we worked very carefully to make sure it wasn't something else, by the way. But once we realized that was the cause and he understood, we call these interoceptive cues, how you understand what's going inside your body, like a churning in your stomach or feeling an uplifting sensation. Once he understood that, the thoughts went away, right? It's the same thing here with anxiety. Whenever you think about your thoughts, metacognition, when you think about how these thoughts arise, and then you get to the core thing that these thoughts are relating to, you will know you have done this correctly because the thought dissipates, it goes away, right? Your mind is trying to problem solve something, but and Yeah, this is just another thing that's so fascinating. Your mind, when it talks to you in terms of thoughts, your brain has to translate sensations into the language you know and then transmit it back to you. It's just a really weird process. But when you communicate with yourself, that's processing as well. It may not always do that in the most effective way. So the way you sit there and you understand your thoughts, that's something that is up for interpretation, right? Just because you have a negative thought, let's say a thought comes up, I'm an anxious loser, right? Does that necessarily mean you're an anxious loser? No, right? It's how you interpret that thought. What does it actually mean? So that's another approach you can take. We often do this in different forms of therapy as a form of thought log, or in CBT, you will see something like cognitive restructuring. You Cognitive restructuring, by the way, this is a bit of an older technique, and in terms of therapeutic approaches, I like to give patients, I more so am interested in changing the context that they identify with their thoughts as opposed to the content of their thought itself. It's kind of a jargony nuance there, so I won't go into it unless people want me to. But thought restructuring, for an example, right? You sit there, take this piece of paper, you write down your thought, and then you take different perspectives, right? What would three other people who you value or hold as an important figure in your life, what would they say about this thought? And then you restructure the thought, you rewrite it, and then you identify, how you feel before and afterwards. That's something you can do with yourself. And ideally, what we get to is people are able to do this automatically. And we see this with people who are psychologically flexible, which is a good thing, right? People who can manage their thoughts effectively. Not only do they sit and watch as opposed to buying directly into their thoughts, they also are able to understand the context of their thought itself. I don't need to sit here and just change the thoughts that come up all the time, because then you're basically playing thought wars with yourself. But if you understand the deeper context of your thought, I feel like I'm an anxious loser. Oh, I just had a hard experience at work. That's it. My mind is just telling me to be aware of that. All of a sudden, then you've got it, right? Then it makes a lot more sense in that case. And again, if you do this correctly, your thoughts will dissipate. I've only got a few minutes here left. I've only got a few minutes left here, so I'll just throw out a few more techniques that people can use. Anxiety is such a big topic. We could probably talk about this for 8 hours. Some other things that you can use here in DBT, you see things like the wise mind, the emotional mind. So again, you're taking different perspectives on how you understand the nature of your own thoughts. In in other types of therapies, you're changing the relationship to that thought. In other practices, you can just sit there with your thought. And this is one that we should use pretty carefully and sparingly. But in some cases, sometimes it's like holding down on a spring too long, and that tension is this just there. So for some people, they just need a floor to like let loose for a little bit, right? Just being able to talk and get everything out, that alone can be therapeutic in some cases, because perhaps the cause is this need to work through and express the emotion of the thought itself. And then all of a sudden, the salience value of that thought is gone, and then you can move on with your life. So in that case, you might take a certain amount of time, let's say like 5 minutes a day or 5 minutes a week. Again, this has to be used sparingly because it can become an issue if you do it too much. And just unload, just let your mind do whatever the hell it wants to in terms of anxious thoughts, but you have to watch. You don't buy into it, you just watch. It's like, okay, you little toddler, I'm going to give you the floor for 5 minutes. 5 minutes, let loose. After that, we're going back, and that's the end of it, right? You're setting clear boundaries with your own thoughts, but you also do not completely ignore your thoughts. If you completely ignore your thoughts, you are going to have issues as well. All right, so there's many other techniques and strategies and things we could do. I hope this helps as a brief overview for anxiety. I think I could have done a little bit more in terms of just giving direct practices. And again, I want feedback from you guys, listeners. I'm doing this channel for you all. I want it to benefit you, and I most importantly want people to become more effective in terms of dealing with and ideally finding an end to their psychological suffering. So whatever it is that you need, let me know. I'm happy to cater to it. I was considering like doing just videos of actual practice, right? Let's forget all the talk. We could talk here for 8 hours, 10 hours, but let's actually do the practice. Do it with me. And then you'll see for yourself how this works. So maybe not. We'll see what people want, but I hope these things are helpful. Anyways, we're at about an hour. I don't see any questions. So, oh, I see one person. If you have any questions, feel free to ask anything you want. Ask a psychologist anything you want on anxiety. If you don't have anything, though, I'll go ahead and wrap up. I'll wait a few seconds, see if there is anything. Yeah, maybe I'll share some articles as well. There's some really important texts. If you're more interested in the neurobiology, there's some great work from Stahl. He's a very well known psychiatrist, has mapped out things super nicely, medications as well. Some excerpts from the DSM that are useful, some tons of literature articles I can think of. I just know anxiety is really common for people. I want them to have some techniques, right? You shouldn't have to pay hourly and go and see a therapist and do all these things. If you want to do that, that's absolutely fine. I just think we need more free things for people. Okay, perfect. Well, I'll go ahead and wrap things up there. Thank you so much for your questions. Good to get to talk to you kind of indirectly, but thank you so much. And I'll see you next week. Take care.